Morning, everybody. We are really excited to have you on the webinar today. My name is Sydney Powell, and I'm in the marketing department here at Revell. I'll be the organizer of today's webinar, and we're really excited to have you on the line. We have some great information lined up on all things annual wellness visits, but before we get started, just a few reminders. I'm going to be recording this webinar, and I'll make the recording and slides available after the webinar. I'll send you an email with everything included so that you can have that for your reference afterwards. And we also have some time set aside at the end of the presentation for questions. So I would like to introduce you to your presenters today. First up, we're going to have Marie Moss, who is a coding auditor here at Revell. And then following Marie, we are going to have Therese Molinaire, who is a certified eClinicalWorks trainer and implementation specialist. And wrapping up today's webinar, we have Tiffany Richardson, who is also one of our certified eClinicalWorks trainers and implementation specialists. All right, and so there are a few of you on this webinar who might be wondering who we are. So here at Revell, we're one of the few end-to-end revenue cycle solutions built for eClinicalWorks users who want an integrated, data-driven, and dependable service. Unlike other RCM solutions that leave your in-house staff following up on claims and answering patient phone calls, Revell offers the expertise, scalability, and efficiency healthcare leaders need to build a richer revenue cycle in a rapidly shifting healthcare environment. We take a team approach to success. Revenue cycle management automation is meant to support our solutions, not replace it. We assign our clients a client success team led by a US performance manager, and these team members come with years of experience dealing with RCM challenges and are here to help serve the day-to-day needs of our customers. You can also expect to work with a billing consultant, coding consultant, team leads, an eClinicalWorks certified trainer, among other team members supporting the RCM process, which also includes certified coders and patient service representatives. As a revenue cycle management service, our goal is really to be a partner with our clients. We know that staying up to date with everything in the Medicare and medical billing field can be challenging, but we care about your success and want to share our knowledge and expertise on everything, including our topic for today's webinar, annual wellness visit specifications. If you have questions about how we help our clients keep up with the industry changes and increase their cash flow, we'd love the opportunity to connect with you after this webinar. So just a quick glance at our presentation agenda for today. First, we're going to be going over an introduction, then components, preventative services, breast and pelvic examination, advanced care planning, practice tips, ECW IPPE preparation, templates, smart forms, advanced directives, and examine vitals. Whoops. So what you've all actually been waiting for, I am happy to switch this presentation over to our first presenter, Marie.
Thank you, Sydney, and welcome everyone. So let's begin. The initial preventive physical examination, as known as the IPPE, is the Welcome to Medicare preventive visit. The goal of the IPPE are health promotion, disease prevention, and detection. It is a separate service from the annual wellness visit. It is not a routine physical checkup, for Medicare does not cover routine physical examinations. It is a visit to obtain a base health care plan unique to the beneficiary. Medicare waives both the coinsurance copayment and the Medicare Part B deductible for the IPPE. It does not include any clinical laboratory tests, but you may make referrals for such tests. Medicare pays for one IPPE per lifetime for beneficiaries within the first 12 months after the beneficiary's eligibility date for Medicare Part B benefits. If the beneficiary does not get an IPPE prior to the end of the first year of their Medicare benefits, then they will be moved forward to the annual wellness visits. To determine if the patient has had an IPPE, we highly recommend you refer to your Medicare administrator contractor provider web portal, for some patients may not remember or understand that they've even had one. Something to consider. If the IPPE is denied by the payer for duplicate and/or lifetime benefit maximum has been reached, it will be difficult to bill out as an office visit due to no treatment or illnesses or conditions. Medicare covers an IPPE when performed by physicians, that could be MDs or osteopaths, or qualified non-physician practitioners such as physician assistants, nurse practitioners, or certified clinical nurse specialists. And something to remember that all components of the IPPE must be provided prior to submitting a claim. When the portion of the visit is medically necessary to treat the beneficiary's illnesses or injury or to improve the functioning of a malformed body member, bill an evaluation and management service using codes 99202 through 99215, in addition to the IPPE and the PIN modifier 25. If you're going to bill the E&M by total time, you can only use the time associated with treating of the illness, injury, or improving the function of the malformed body member. Not any of the time can be associated with the IPPE. For the diagnosis, you must report a diagnosis code when submitting a claim for the IPPE. Since you are not required to document a specific diagnosis code, you may choose any diagnosis code consistent with the beneficiary's exam. The Z00 codes are the most commonly ones used. Z00.00 is an encounter for a general adult medical examination without abnormal findings. Z00.01 is an encounter for a general adult medical examination with abnormal findings. So therefore, the coding guidelines is to use an additional code to identify those abnormal findings. When you use the Z00.01 and the additional codes for the abnormal findings, this will support a pinning modifier 25 to the E&M. We always recommend that you reference your Medicare administrative contractor for any coding and billing guidance. The billable codes for the IPPE and their appropriate Medicare allowed amounts. First is the G0402. This is your initial preventive physical examination, IPPE, and it is a face-to-face visit. The next three codes are for the electrocardiogram screenings, which have a copay and/or deductible when done during the IPPE. G0403 is the global service of the electrocardiogram, and it includes the interpretation and report. G0404 is just for the tracing only, and G0405 is for the interpretation and report only. The Health Resource and Services Administration provides funds to the federally qualified health centers, known as the FQHCs, for the IPPEs. You code G0468 for either the IPPE or the annual wellness visits using the same eligibility guidelines for the services. The co-payment, co-insurance, and deductible are all waived for this service. So let's begin with the components of the IPPE. Remember, all of the components have to be completed in order to bill for this service, in which there are a total of 7 of them. The first one is to review the beneficiary's medical and social history. At a minimum, collect information about the past medical, surgical history, and this can be experiences with illnesses, hospital stays, operations, allergies, injuries, and treatments. Next, current medications and supplements, and this also includes calcium and vitamins. The family history, review all medical events in the beneficiary's family, including conditions that may be hereditary or place the beneficiary at risk. History of alcohol, tobacco, and illicit drug use. diet, and physical activities. For information about Medicare coverage of substance use disorders services, refer to the Medicare coverage of substance abuse services and the screening, brief intervention, and referral to treatment services booklet. For the history of alcohol, tobacco, and illicit drug use, we encourage providers to pay close attention to opioid use during this part of the IPPE, which includes opioid use disorders. If a patient is using opioids, assess the benefit for other non-opioid pain therapies. Also assess if the patient does not have an opioid use disorder, but is possibly at risk. To help reduce the misuse of opioids, CMS created a roadmap to address the opioid epidemic, the fact sheet, which provides a wealth of information for the provider and the patient. The next component of the IPPE is to review the beneficiary's potential risk factors for depression and other mood disorders. Use any appropriate screening instrument. You may select from various available standardized screening tests designed for this purpose. For more information, refer to the depression section of the Substance Abuse and Mental Health Services Administration, and you can find this with the Health Resources and Service Administration's screening tool website. The third component is to review the beneficiary's functional ability and level of safety. Use appropriate screening questions or standardized questionnaires recognized by national professional medical organizations to review, and at a minimum, review the following areas such as activities of daily living, fall risk, hearing impairment, and home safety. The fourth component is the exam. You will need to obtain the following: height, weight, body mass index, and blood pressure, visual acuity screen, and other factors deemed appropriate based on the beneficiary's medical and social history and current clinical standards. The fifth component is the end-of-life planning or on the beneficiary agreement. The end-of-life planning is a verbal or written information provided to the beneficiary about the beneficiary's ability to prepare for an advance directive in case of an injury or illness causes them to be unable to make healthcare decisions, and whether or not the physician is willing to follow the individual wishes as expressed in the advance directive. Other end-of-life planning could be a POST, which is a physician's orders for life-sustaining treatment, or a MOLST, which is medical orders for a life-sustaining treatment. These forms serve as a medical order in addition to the advance directive to provide guidance for the healthcare professionals to act on immediately in case of an emergency. Here's something to think about. Most patients have a living will with their attorney and do not understand the steps that have to be taken for a healthcare provider to obtain during an emergency. The sixth component is to educate, counsel, and refer based on the previous 5 components. Based on those results of the review and evaluation services in the previous components, provide appropriate education, counseling, and referrals. And the last component is also to educate, counsel, and refer for other preventative services. This also includes a brief written plan, such as a checklist, for the beneficiary to obtain. We have provided here a hyperlink of the checklist. In addition to the IPPE, the provider can perform and bill for a cervical or vaginal cancer screening, pelvic and clinical breast examination. A screening pelvic examination with or without specimen collection for smears and cultures should include at least 7 of the following elements. This is something definitely to go over with the providers. Many times this is missed. Once again, 7 of the following 11 elements. The copay and the deductible are waived for this services. Next, we have prolonged preventative services that may be reported in conjunction with a covered preventative services. The coinsurance and deductible are waived when billed with the covered preventative services. The appropriate time should be documented in the medical record when it is used as the basis for code selection. G0513 is for the first 30 minutes, and G0514 is for each additional 30 minutes. The advanced care planning is part of the IPPE. It's actually component number 5. However, if in between the IPPE and the annual wellness visit, the patient, family member or members, and or surrogate returns for additional care planning, bill 99497 for the first 30 minutes of face-to-face time and 99498 for each additional 30 minutes. There are no limits on the number of times you can report an advanced care planning for a given patient in a given period. When billing this patient service multiple times, document the change in the patient's health status and or wishes regarding their end-of-life care. The deductibles and coinsurance does apply when advanced care planning is provided outside the covered annual wellness visit. Here we have an IPPE scenario for female beneficiaries. Please keep in mind the advanced care planning is not charged separately on the day of the IPPE, but could be within the year prior to the annual wellness visit. First, we have the IPPE with approximate amount of $168. ECG, or as we all know as the EKG, is $15. The pelvic and breast exam is $40. The prolonged service for such as disability could be of 30 minutes, that would be $67. And the advanced care planning for 30 minutes would be $86, for a total of $376. And with a multiple of 100 female beneficiaries, it would be a nice sum of $37,600. Here are some approaches to help your practice get started. Identify patients who would benefit from a discussion regarding their self-management health goals. Choose patients which the staff has identified as likely within the first 12 months of Medicare coverage. Make sure to document diagnoses and conditions to accurately reflect patient severity of illnesses, such as for the hierarchical condition categories, the HCCs, and the risk of high-cost care. Some patient handouts is the patient fact sheet, letting them know of this type of service and what they could be responsible for and such, and the patient letter that you could send out to your patients, letting them know that they're soon upon the service, and also the checklist. And below is the hyperlink for this. And now I will hand it over to Therese. Thank you.
Thanks, Marie. As Marie presented on the Medicare requirements, I'm going to show you a few helpful tips on trying to identify those patients that are going to be eligible for the IPE visit within the first 12 months of becoming eligible for Medicare. I'm going to use the registry for this. So if I click on registry, now I'm looking for those patients that are 64, going to be 65 in 2021. So if I am in the registry, I'm just going to go by date of birth. I can click this. I can manually type in, and I'm just going to do it for the whole year of those patients that are going to be turning 65. You can, depending upon the number of patients you have, you can do this quarterly, monthly. Like I said, we are in a training database, so I'm going to do it for the entire year. Once I put in my applicable, whoops, date of birth, sorry about that. I'm going to put in 1957. Wouldn't do it me any good to pull it for this year. So if I click that, so now I have all those patients that were born from January 1st through December 31st of 1957. They're 64 years old, and I want to identify them because they're going to be turning 65. And I have the ability then to maybe get them in for an IPE for that extra service. So if I click Run New, it's going to show you my 3 patients. So from here, I can save this query, right? And if I save this query, it's a specific, naming convention, just to show you I've already saved it, but you can give it a name, the report criteria, all of these things, and save it. It will show up over under registry. I'll show you that in a few minutes of where that query will save so you can access it again. But from here, I've identified these patients. Now I want to run a letter. So as Marie spoke earlier, we have a welcome to Medicare letter. We also have an advanced care plan letter. So if I click on my star to bring up my favorites, you can see that I have a welcome to Medicare and the advanced care plan letter. Both of these letters can be sent out to your patients. You can add letter tags or whatever specifically you want for your specific practice. And both of these letter templates will be attached to the actual webinar, so you'll have access to them. But from here, I can click on this icon. I can run these letters for my patients. Okay, I can run this Medicare one, the Welcome to Medicare, as well as the Advanced Care Plan. Okay. So if I close out of that, so that's letters that can be sent to those patients, right? So to help them become more educated and more prepared, right, for the program. But another thing that I can do to help identify these patients is using a global alert. And I can actually set that from this screen because I can get to the patient's hub. So I'm going to uncheck everyone, and I'm going to use Madeline Test as my patient. So I'm going to click on the patient hub, and I'm going to go to her demographics. So I'm going to click on info to get to her demographics. And down at the bottom of this window is the alert button. Now there's billing alerts, there's global alerts, right? There's many different alerts, but I'm going to concentrate on global alerts. So up at the top, I'm going to click on this gear icon. Now, within global alerts, there are appointment and billing alerts, which display from the appointment window. You have clinical alerts, which display in the progress note. And then you have both. And that's what I'm going to set for this particular program is I'm going to create an alert for on those patients and set a global alert for those patients that are 64 going to be 65. So if I click on this, it simply brings it over to the right. And if I click on it, you can barely see it. There's a bell. I'm going to set that as my default. Okay. And once I do that, I'm going to show you, right? I'm going to get out of this window and I'm going to cancel out of here. And now I'm going to go to the resource schedule. So in this window, right, I identified my patients. I saved my query, right? So if I go to my registry reports, whenever you save it, you can see you're welcome to Medicare, right? And then you have the ability that you can run that report in Excel so that you can get to those patients, right? If you wanted to track them for whatever purpose, they're here, right? So I'm going to X out of there, but now I want to go into the resource schedule. I'm going to make an appointment for my Madeline test. Oops. Bear with me. So I'm going to come up here and I'm going to look for my Madeline test. Now, I've also taken the liberty in lieu of time. So here is my global alert. Do you see how it displays on the appointment window? It automatically pops up because I set it as the default. So the front office staff would know that this patient is eligible for the Welcome to Medicare visit. Tiffany will show you in the progress note where this applies on the progress note side. But I'm going to go ahead and from this, I have created a IPE visit. Right here, a welcome to Medicare. This is called a visit type. And I did that, and I can also come in here and I can type welcome to Medicare, right? Do I have to do this? No. But is it helpful? I believe as a trainer, yes, because now I've identified this particular visit type, right? For these patients, you can run reports by that, but I also am helping to alert the back office staff of why this patient is coming in. And so if I do that, then on the back end, they know that this patient is a welcome to Medicare patient. And if I have a template, I can apply it at that time. I hope that makes sense. And now I'm going to turn it over to Tiffany to show you that template.
Thank you, Therese. All right, let me get over. Hang on, my screen is not popping the right way. There we go. All right, so I'm going to show you the template and the other elements that Murray had gone over in the IPPE requirements. So Teresa's already created an appointment on the schedule, and I'm going to go ahead and click onto that appointment. I know that the reason the patient is here, because I can see in the office visit window that the patient is here because of the Welcome to Medicare visit. The visit type is also an IPPE visit type, so that indicates that this is a IPPE visit. So if I start off, I want to go into the patient's chart. And then when I'm in the patient's chart, as you can see over on the right-hand side on the right chart panel, where Therese had mentioned the global alert, now it appears on the right chart panel that there is a global alert for an IPP eligible patient. You can see the chief complaint says welcome to Medicare. Often you want to remove that from the chief complaint. It's just as the reason appears into the chief complaint, is the reason that that came over. When you mark the reason, it automatically displays in the chief complaint. So the first thing with the templates, as Marie had said, there are some elements that are required. We created a template that covers a lot of those items. There are some items that we're going to review in the smart forms that are already available for you to use, but we're going to review the template first. So if we go to our right chart panel, I've already created a template, and that's something you can do yourself, and we'll review that a little bit in depth later about creating structured data and how to build those templates. But for this example, we're just showing you how to move that template into your chart. So we've already created a template over in the right chart panel. I have it here, and it's going to be called TR-IPPE is the one I have labeled here. If I click on this view button, this eyeball here, that lets you see what's in that template. So if you wanted to see what was available in the template to see if that's something you want to merge into your note, then you'd be able to see what's included here. I'm going to go ahead and merge that template into the note. And it's going to include the health risk assessment, the exercise, the general health pain assessment, your home safety assistance assessment, which is all part of the items that are included in the presentation that Marie presented. The immunization status, whether it was addressed, their vision screening, their hearing screening, whether those things were addressed as well, their fall risk and home safety screening, their psychosocial risks, behavioral risks, and activities of daily living. Within this template, you can just click on the different area. If you click on the black text itself, it'll take you in what's called a click-through, which I really, really like. It makes life a lot easier when you're trying to answer these questions without having to go into the HPI section and go into the categories and then document those different categories. It's just an easier view to be able to document and update that information. So you can go in and update that information based on the selections. It is, and then once you've answered all the questions within the template, the other thing you can do within the template is add your assessment. So if you have your diagnosis code for a normal or abnormal exam, screening or whatever for adult screening, as Maria had said, you can add any testing or anything that you would want to include in this template. We'll go over more in the preventative med in our third session, so we're going to skip over that. And then you can also add your procedure codes based on the type of services that your practice offers. So if your practice offers the EKG, you can include that in your procedure codes. If you're doing the breast and vaginal exam, you can include that as well. The other elements that are included in the elements of the IPPE are the smart forms. Have a lot of those already built in. We have a lot of the smart forms, should have every smart form that's available through ECW. The ones that you're going to focus on are the Audit C. So you're just going to go into the Audit C and answer those questions. And then that should populate into your note into the social history section. You're going to go into your Audit C is your alcohol screening. You have your opioid 2018 edition. That's your opioid screening. So you can go in and answer those questions. Save that. Go to your next one. You have your PEG scale. Answer those questions. And I'm going to show you, these are all going to appear in the note into different sections of the note, depending on where it was built and mapped. So with the depression screening, you start with the PHQ-2. If they answer these, clicked on the wrong one. If they answer the questions in a certain manner, it will put them into the PHQ-9 if they are positive for any of these questions. And then that also ties in, if they are positive for depression screening, you have to continue to screen them throughout the year until they are no longer, until they reach a certain score on their PHQ-9. Then you have your sexual history screening. I'm answering no just for time constraints so that I can get all of these smart forms in here. Otherwise, those smart forms, when you answer yes or you answer certain ways, it's going to pre-populate more additional questions based on your selections. And then I'm going to go to tobacco control. I can answer all those. And then again, as you can see, those are going to pull up additional questions, answer those, and close that. All right, so now as you can see the note, we have the template which dropped the elements that are not included in smart forms. We have the depression screening, the PEG scale screening. We go down to our social history. Here's your tobacco screening, your sexual history screening, your drugs and alcohol, your opioid. All of those screenings are going to be available now into your chart. Just quickly, within a few minutes, drop in the template, drop in the smart forms. We've already done almost all of the elements that are included in the IPPE. The other one that Marie mentioned, and Therese as well, is the advanced care planning. So Therese had showed you the letter that you can provide to your patients prior to their visit so they can be prepared to, with those questions and those answers, so they know what kind of questions to ask the provider when they're getting that consultation regarding their advanced care planning. So within your right chart panel under overview, there is an option here that says advanced directive. If you click on the 3-dot ellipsis next to advanced directive, you all have the option to now set their wishes, their medical wishes at this point. So you can mark them as a DNI, a DNR, a living will, power of attorney, however you want to mark this. And you can also add additional advanced directive measures here as well if there's something here that's not matching. So you just select add and you can add additional items. But from here, you can mark whichever selection that the patient wishes, and now it's part of their advanced directive. And this is nice because from the patient hub or from a lot of other screens, anywhere you can see the right chart panel on the patient hub, the progress note, you can see their advanced directive just right quickly and easily without having to go and dig in the chart to find out what that patient's wishes are. You also always want to include the advanced directive paperwork in the patient's chart. So we go to the patient demographics, we go to additional information, and from additional information, you have advanced directive here. If you scan it from here, it's going to automatically put it in the advanced directive folder. You can scan it and attach it to the patient's chart to the advanced directive folder, but this is nice because you don't have to direct it to go there. It's going to automatically go to drop into the correct folder. So it's really easy to complete the advanced directive piece of it. The other elements that we need to include are some of the elements that we have in our exam and our vitals. So as Marie had mentioned, that the blood pressure, the BMI, the height and weight all have to be included. There are some things you can do to trigger your staff that they have to include certain information. If you create these as mandatory fields on their vitals, would not allow them to leave the screen until they had marked the mandatory fields. I'm going to go ahead and put in a blood pressure, a height, and a weight. And it should automatically populate the BMI based on the height and weight. The other elements that you can build into your vitals is your vision and your hearing screening. You want to make sure your pop-up is turned on if you're going to use this because the attributes are included in that pop-up. So when I have the pop-up on, that's why in the blood pressure you saw those additional attributes. So for instance, on the vision, we have it set up where you can go ahead and mark left eye, right eye, both eyes, whatever it is, document the elements here that are necessary with or without glasses for their vision screening. And then their hearing screening as well. You can go ahead and mark and answer those questions and then apply. And now I have my vitals documented with all of the hearing, the vision, the BMI, the height, the weight, the blood pressure, all included in this. The other element that Marie had mentioned was the breast and vaginal exam, which is what we consider the genitourinary exam. That is already built into your system. ECW, it's one of those predefined builds that has already been built into ECW. Let it load. There it goes. All right, and so we're going to scroll down to genitourinary, and you can choose either female or male based on your patient selection. I'm going to go ahead and choose female just because there's a little bit more involved. And as Marie has shown in that presentation, the items that are included, they're already built here for you. So you can just go in here and answer these if you're doing that exam and be able to complete this piece of it. And that is the template. We put in our chief complaints. These are just some additional knowledge for use. If you're at FQHC, you might want to use a different code in your procedures, procedure codes at the bottom. If you, all others use the G0402, which is what we have in this note. You know, make sure that they know the co-insurance co-payments are waived. There's also some Medicare Part B. All of this was explained in Marie's presentation, and this is just a little note for us so that we have that information when we're doing our templates. And that is how you would be able to document all the information. And then in our third series, the third series that we have coming in a couple of weeks, that one will go into a little bit more depth of how to use some different parts of ECW to help you know what orders that you need to complete for patients and such. All right, thank you, Sydney. I'm finished with this presentation.
Great, thank you so much, Tiffany. That was some really great information. And just give me a second here while I'm catching my bearings. All right, there we go. So that was a lot of really amazing information from Marie, Therese, and Tiffany. If you missed anything, don't worry. I will be emailing everybody later on with a webinar recording and slide deck. So now that we've reached the end of the presentation, we're going to take some questions that you might have at this time. So if you do have a question, type it into the chat panel on your screen, and we will happily get to those. So as we wait for the questions to roll in, I want to make sure you know how to get in touch with us if you'd like to learn more about any of our services here at Revell. Following the webinar, you'll get a short survey where you can let us know how we did or request for one of us to get in touch with you. You can also simply reply to one of my follow-up emails, and our team will be quick to get in touch to see how we can help you. We can also set up a discovery call with your practice and one of our representatives. This will help us talk through pricing and next steps for your clinic. If you're interested but aren't quite sure if it's a good fit, I'd still strongly encourage you to contact us so we can put together some detailed information based on eligibility and your specific goals. Additionally, like Tiffany had mentioned at the end of her presentation, this is the first of 3 webinars in this annual wellness visit series. So make sure to come back over the next 2 Thursdays, same time, same place, to catch parts 2 and 3. You don't want to miss it. There's so much great information packed into the hour, and we are really excited about everything that the presenters are presenting on. So the first question that I see here: can multiple people access the registry?
I can help with that one, Sydney.
Sure.
I can share that if you want me to share my screen.
Yeah, let me.
So go ahead. To answer that question is no. It is registry is designed to it's a huge reporting mechanism, and only one person can be in the registry at a time. It does require a security permission, and what I failed to do earlier is normally I would clear my search, and then there right here is a release lock. And so when you're done, you need to click that release lock, and then that will allow others to get in and run any type of report that the registry will allow you to. So it is a huge reporting mechanism, and only one person can be in it at a time.
Great. Awesome. That makes sense. Thank you, Therese. And again, let me just grab my screen up real quick. All right, there we go. Okay, I see a couple more questions rolling in. So what if a patient fails to get an IPPE by the end of their first year of Medicare eligibility?
All right. Well, as I said in the presentation, that the patient has 1 year to complete this. And if they don't, it's not the end of the world. Everything's okay. Because as you're going to learn in our second series, the initial annual wellness visit is very much like the IPPE. It has just a little bit difference in it. So definitely we would recommend that you confirm it with the MAC portal. And if it indicates the patient has had an IPPE, then definitely at that time, take that opportunity and schedule the patient for their annual wellness visit, which has to be 12 months past the IPPE.
Great. Awesome. Another question I see is, can a patient be charged for an office visit along with an IPPE?
We get this question so many times, and unfortunately, because most patients, when they go in for their IPPE or annual wellness visits, they're thinking, oh, good, this is all going to be covered. And it is. However, you can be charged for an office visit if the provider treats any illness or condition, even as much as refilling meds or ordering labs. There can be a fee for an office visit.
Great. All right. Is the exam a full body systems exam?
No, it is not. The examination is based off of the patient's medical and social history, and if there's any current clinical standards. So an example would be if a patient comes in today for an IPPE and the patient has a medical condition of a history of diabetes, then the provider would, yes, they would examine the patient's hands, feet, and skin for just an example. So they would need to examine the patient's, other body parts if there's no medical history or social history that would indicate to do so.
Great. All right. What if I don't have all of the smart forms that Tiffany showed?
If they don't have the smart forms, contact ECW, and then they will be able to load those smart forms into your database. Those we should have all the smart forms that are available. So there's a few of them, like the respiratory illness screening, that's not necessary for the IPPE evaluation. But if you want to get additional smart forms, just request that ECW add those smart forms to your database.
Great. How do I remove the global alert from a patient?
Therese,
Hi,
do you want to
Tiff.
show that?
Yeah, sure, I'll show that. Sydney, if you can give me the
Alrighty.
option.
Yep.
Thank you. So I'm going to go into my test patient that I used previously, Madeline Test. And I'm going to go into her demographics. Creature of habit, it takes me to the hub first. So down at the bottom where I went to go set the alert, I can also remove that alert. So I'm going to go back to my gear icon. And once I have had this patient or I performed this visit for this patient, I can simply click it, use the dual arrows pointing to the left, and take it off. And now this alert will not display for my patient anymore. Thank you. And
Great.
that's how you remove the
Awesome.
global alert.
Good to know. All right. Well, I am not seeing many more questions roll in right now. If you do happen to have a question, please feel free to leave that in the chat or send us an email and we will happily get to your question. But it looks like that's it for now. So I'm going to go ahead and wrap up the webinar. If you have a quick minute after the survey ends or after the webinar ends, please take a minute to fill out that survey. It's really helpful for us. But thanks for taking the time to join us for an hour on all things annual wellness visits, and we look forward to seeing you next week, same time, same place. Have a great day, everybody.